presenting this on Sunday, and this is analysis of patients with a durable remission on the HMA event therapy. This is combined analysis from the VIALE-A and the phase 1 study that included patients similarly treated, and also looking at the azacitidine placebo cohort. So there are a couple new findings from this analysis. So first of all is that patients who stay for a long time on the therapy, the mutations that we see are somewhat different than people who relapse early. So we know that mutations in P53 and signaling mutations are common in patients who relapse early. But in those who stay on the treatment for a long time, we see signaling mutations, but in addition we see mutations in transcriptional regulators, so that's something that was not really understood previously. But we see them across both cohorts, so we don't think that this is specific to Venetoclax, so it looks to be kind of mediating progression in both Venetoclax arm and also azacitidine arm only. Another interesting thing is what we saw is patients who had NPM1 mutated disease. We know that they respond usually well to HMA event-based therapies. And out of 7 patients who lost NPM1 at the time of progression or remission, so essentially there are some patients with NPM1 who are relapsing without NPM1. And this is like totally unexpected because NPM1 is thought to be like a stem cell marker and it's a very stable marker, so we usually don't see loss of NPM1 at the time of relapse, which tells us that Venetoclax is really potent in eradicating of NPM1 clone, but also that the progression is caused by different clonal architecture. And finally, we looked also at the mutation in BSO2 family genes because BSO2 mutations have been shown in CLL patients who stay on the treatment for a long time. So there was always a question, if patient is with AML on HMA event for a long time, would they develop BSO2 mutations? So we did not observe any BSO2 mutations in this study, which is somewhat encouraging. But we did see mutations in the protein called BAX, which is required for execution of cell death. In about 17% of patients in the study, we saw BAX mutations, which is consistent with the prior literature by Australian group. So I think these are the novel findings. Amongst the genes that were transcriptional regulators, the RUNX1 was one of the most common. But the findings were somewhat mixed because some patients lost it, some patients acquired that, and some lost and acquired, and some remain stable. But it certainly appears to be one of the common genes that is involved, and I think the future research is required to understand how RUNX1 influences either response or progression.